Your Health Matters with Dr. Benjamin Bryant, Chief of Staff and Chief General Surgeon of UH Conneaut Medical Center. And Dr. B, did you have power this morning?
Well, at 7 o'clock.
Yeah, me too. 7:30 for us.
Prior to that, no.
We went out at 3, so we were out 4.5 hours.
Is that right? Yeah. Gosh.
And still don't know why.
Well, you said you saw a bright flash?
A bright flash, just as it happened.
That sounds like a transformer.
Yeah,
That's-
so.
But then somebody was saying that there was an equipment failure in Mansfield?
Mhm.
That's what I heard, or,
Possibly.
social media, that's what they said, so.
Right.
Holy smokes, that's a big, oof. Well, we were recovered now. We're back.
There was a lot of people without power this morning, so luckily it's back on and we're ready to go. I see we have a good friend of mine here with us, Doc.
Well, Pat, since you know this gentleman so well, why don't you introduce him?
This is Dr. Gerald Orlando, who I've known since he was a little guy, and of course known his parents, Linda and Jerry Sr. His dad, of course, runs the Golden Dawn here, Orlando Brothers Golden Dawn. And Jerry's one of those guys that came back to Conneaut to live in his hometown.
That's
and
awesome. That's great.
It is great. And has a practice here right across from the hospital at the medical center here with across the street from UH Conneaut Medical Center. So, Jerry, give us a little back. I know you and I did an interview last week for Town Talk, and you'd probably tell us where you went to school and a little bit of your background.
Okay, so, well, I started undergrad at Gannon, and I have to be honest, chiropractic was not my first choice. I thought about doing pharmacy. And the more I got into that coursework, I took an anatomy class, and then I kind of fell in love with the body itself.
That's how it happens.
Yeah, how it all just kind of connects and works together. So I ended up shadowing a chiropractor, and I used to get chiropractic when I was a little kid. Playing sports, hurt my back or something.
Sure.
So I'd see a chiropractor, shadowed one, and I liked it. I liked the one-on-one, the hands-on approach.
Right.
So.
Now, Dr. Orlando, what is a chiropractor?
A chiropractor basically would be somebody who looks at the body on a holistic approach, meaning, we're trying to do the least invasive route, getting that person feeling better. From manipulating the spine, the joints, we're not just a neck and back. You can come in with a shoulder or a knee or an ankle, any joint in your body, something that I can deal with. So, I want to kind of restore proper motion, to those joints and to the spine.
What's the difference between a physical therapist and a chiropractor?
Well, a physical therapist, at least when I think of it, a physical therapist definitely can show you stretches and strengthening, routines.
Mm-hmm.
I also was trained in that, so
Okay.
I can give you stretches.
Right.
I can show you how to strengthen certain muscle groups. I have the same therapies that physical therapists have, the decompression tables, the muscle stimulation, the ultrasound. So I can do that. When it comes to when to go to one or the other, at least when it's talking about me, come see me, and then I can kind of guide you in the route to go. Physical therapist, I think if God forbid somebody were to have a stroke, that's when you'd want to go to a physical therapist. Somebody who can sit and spend time and retrain and re-educate those muscles to get back to their proper function. They can set aside an hour to, spend with you.
What about medication? Do you believe, see, I'm not real familiar with your position. I've just started with you. I had a session Monday. But do you believe in medications?
To some extent. Medication, if we're dealing with strictly in pain relievers, muscle relaxers, they're good and they're bad. Bad in the sense that it's a Band-Aid. It's not solving any problem. It's making the patient feel better for the time being. It's, you know,
I think that's a very important distinction.
Mhm.
yeah, and you know, a lot of the times if I tell patients, and if I see patients, I'll tell them, you know, it's okay, go ahead, take some kind of, you know, non-steroidal anti-inflammatory, because if a patient has so much inflammation or tenderness, it's prohibiting me from doing my job.
Sure.
So I need a little bit of help, but the patient also needs to realize that by taking that kind of medication, their problem is still there. And they need to still be careful with how they move and how they bend.
As I've told you before, I think Doc knows this, my dad was a World War II veteran who was injured in the war very severely with a back problem and had 3 surgeries, and unfortunately took medication for it. And I hate the word to use the word addiction, but I believe that was a problem over the years, and it ruined his life. It really did.
Yeah, the thing about that is that it's real.
Yeah, absolutely.
It's real. The most, people know this, the most effective pain relievers are narcotics. Narcotics, under certain circumstances, will cause a physiologic addiction. That's something that happens at the cellular level and is outside the person's control.
Mm-hmm.
Okay, I mean, you can break an addiction, not an easy thing to do, but there is always that potential. Since we're on that subject, I'm just going to throw a couple of things
Sure.
in here, because you know, I have patients, I see patients, and I'm going to do a surgical procedure where an incision is involved, and that is a proper role for those strong kinds of pain medications, because surgical pain is real.
Mm-hmm.
And I've had people ask me, well, you know, you're going to give me oxycodone. Will I get addicted? And I like to be able to have the opportunity to say this to the public: no, you won't. Why not? Because you won't be taking enough, and you won't be taking it for long enough.
Right. I remember you telling me that years ago.
Yeah. So people shouldn't be afraid. It's a funny thing, after, for example, if somebody has a gallbladder operation, the acute surgical pain doesn't last that long. Okay, 48 hours, 72 hours, and then the pain really starts to drop off.
Mm-hmm.
And the pain medication, when you take it fairly liberally in those first few days post-op, is really helpful because it helps you to get up and around and move, which is really important.
Right.
Very tough to do, very tough to cough, which you need to do to keep your lungs clear without that pain medication. But that requirement disappears fairly quickly, and then the amount you're taking goes down. You're not going to get addicted. I just wanted to reassure people about that. Now, having said that, and I'm sure you can attest to this, prescription pain medication addiction is an exploding problem in the country. I mean, we get alerts about it all the time. We have the ORS program, which helps us when we see patients. We see what different pharmacies and different doctors are giving pain medicine. It's a terrible, terrible problem.
Mm-hmm.
So you do not take them unless you need them. And as Dr. here says, he's absolutely right. It does not get to the root cause. It just sort of gives a temporary relief.
Mm-hmm.
So somebody comes in. What is the most common complaint, or the 2 most common complaints that people have when they walk into your office?
I would have to say one would have to be low back, you know, sciatica. It's down their leg, and it's starting to. It seems like I'm getting a shift into a lot of patients having headaches, and their neck is starting to get just real stiff, tight. So
Tight, and your headaches, tight, stiff neck,
Mhm.
and low back pain, sometimes radiating into the legs.
yes.
Okay? So you sit down with that patient, they come and they talk to you, they realize fairly quickly, hey, okay, I can talk to this guy, he's a nice guy. And what do you do with that patient? I mean, you got to kind of tease out what's really going on.
Right. Basically, I put them through a series of tests, trying to determine, is it a muscle issue or is it a nerve issue, and that kind of then
Okay,
steers
so
me in.
it can be either one of those.
It can.
And which direction you're gonna go is gonna be real different depending on. So you have to sort that out.
Right.
Okay.
Right. If I can, I'll use Pat.
Mhm.
He gave us permission.
I did.
I saw him on Monday,
Mhm.
and you got the low back,
Right.
down the leg. We put him through, range of motion to see if there was a certain motion that he does that irritates.
What he did, what really impressed me is he sat with me for probably a good 15 minutes and asked me all kinds of questions in a verbal kind of interview that kind of established what was the pain, what was it from 1 to 10, and
What makes it better? What makes it worse?
right, and how long have you had it? And in my case, I let it go way too long. This has been months of suffering. And I will say this, and I want to say this right now, I highly endorse this young man because the first day I could actually bend over for the first time in probably 7 months, and I could move and walk normally. Before I was walking like Tim Conway, the old man, and I could finally walk, and that was within probably 8 hours. So very, very.
Well,
But you said
That's
you
impressive.
said my leg was shorter than the other.
It was. So you had so in your case, you had two components. You had some muscle involvement,
Mhm.
and you also had a nerve involvement. The muscle involvement, which was causing the hips to become misaligned. So if I remember correctly, I believe your right leg was a little shorter than your left. So what happens? I brought a
Yep.
little tool.
Okay.
So I brought the spine. Okay. So when I'm going to do this, when I'm looking at your back,
Mhm.
your hips. Okay. So your right side, I said the leg was shorter. So you were kind of like this. That the hips were tilted a little bit. Muscles on the right side, they were tighter.
Okay.
So and the muscles attached to each side of the spine and then to the top part of the pelvis.
Mm-hmm.
So when those muscles get tight, they pull things closer together. Now I'm exaggerating things just to
Oh,
give
right.
people an idea, but that's what would happen. So it's going to make you appear like a leg is actually shorter than the other.
Okay.
So when I worked on you, we started you off with the muscle stimulation. So I put pads on your low back.
Explain that. Yeah.
So the muscle stimulation basically is to help try to reset your muscles, try to get them to calm down. They're too tight, so we try to give it a constant stimulation to kind of reset those muscle fibers so that the muscles do their normal job.
Okay.
So we did that, which helps things kind of settle back down. I put some of that cream on your
Which is very good. Yeah.
on your back, which again, it's going to work after you leave. It's again to help keep those muscles loose. And then the adjustment I gave you just basically helps really realign the hips, the pelvis,
Mhm.
back up again.
Mhm.
The second part, when I said there was a nerve component, there was pressure on your disc. That's why you were feeling it going down the leg.
Okay.
So I had you on, I did a little bit of traction, kind of stretched out the low
Right.
back, which when we do that, again, this isn't gonna separate, but it's a pulling motion. So it's opening up those disc spaces, taking pressure off the spine,
Mm-hmm.
and then when the bottom part of the table drops, it really helps open things up. So it would take the pressure off that nerve,
Mm-hmm.
and then eventually would end up, relieving that pain down your leg.
And you actually said, while I was laying there, that your legs are now the same size or the same length, or
Yes, yeah. Immediately after, adjusting, there's going to be, it's going to be an immediate, change.
was I favoring that right side or?
There's a number of reasons why, the muscles would cause the hip to be off like that. There's no set one thing that caused it. It could be as simple as you going up and down steps.
Mhm.
You know, a lot of the times people, how they get in and out of their car, you know, most people don't sit butt first in and then spin their legs.
Right.
You know, it's always one leg in, and we're just going to shift all our weight onto that leg. And then when you get out of the car, one leg out, let's shift all our weight onto that leg.
I do that.
So a lot of the times I would say it's more how you get in and out of a car
Okay.
that does it, but there's no definitive.
A simple thing like that. For me.
Yeah, you should do it enough times.
Yeah, yeah, during the day.
Yeah.
Now, sometimes I'll see people pick something up,
Mm-hmm.
maybe has some weight to it, and they bend over, and they don't bend their knees,
Yep.
and then they pick up and it's like a fulcrum, and all that pressure is on their back. That can't be right.
No, it's not. I mean, one, you're putting a lot of stress, a lot of strain in the muscles in your low back. And so you're definitely going to injure those muscles.
Sure.
And then depending on age, because, you know, I hate saying it, but it's true. As you age, so does your spine. It can't stay 20 years old forever.
Right.
And as you age, the spine starts showing signs of degeneration, which, you know, everybody gets it. So you have that, you couple that with the muscles getting overworked, overstretched, you know, the discs aren't as healthy as a 20-year-old, so, you know, you don't bend with your knees, you're gonna
Is that degenerative disc disease? Is that what that is?
Yeah.
Is it all, I mean, that might
Well,
be
they lose height, and they lose some of the moisture, so they contract, and then the spaces where the nerves go through get crunched.
Now, I've never asked you this, and you and I have been friends for a long time, but I've noticed, I used to be 5'11", and I think I'm about 5'9" now. I mean, I've lost the height.
Mhm.
Because my pants, when I buy the pants, they used to fit perfect, and now they're hanging over my feet, and is that normal?
The short answer is yes, but I think Doctor here can probably explain that to you.
Okay.
So again, just the whole, it's part of aging. So as that degeneration starts setting in, like you know, Dr. Bryant was saying, you know, the discs start losing their cushion,
Mhm.
you know, and because we deal with gravity, you know, you got weight starting to compress everything. We sit the majority of
Yep.
our life, so you have that going on. So usually, yeah, as you age, you start shrinking, and it starts usually in your low back. Usually that last disc space is the first one to go, and then it just works its way out.
I know Dr. Bryant's a real big proponent on exercise and watching your weight. And does that weight have anything to do with this problem that we're talking about?
A little bit.
A little bit?
Yeah, I don't want to say weight's the only problem,
Mhm.
but it doesn't help, you know, because all the weight's usually in the front,
Yeah.
and again, you got gravity, and it's pulling forward and then down. It's really, so if you take our spine back out, if you had, you know, your big belly, okay, so it's really going to cause
Whoa.
that. You know, it's going to really emphasize the curve in your back, which really starts, you know, and you can see it. It's putting a lot of pressure
Sure.
and strain on the joints, on the disc, on those nerves. So yeah, weight doesn't help, but weight's not the only reason.
Doc, you do a lot of surgeries. Do you stand during those surgeries?
Oh, yeah.
Does that bother you at all?
No.
It doesn't. So your back's pretty strong.
Well, I suppose so. I mean, I worked in a feed mill when I was younger.
Oh yeah, that's why he's got the strong handshake. Yeah,
Well,
you did.
that's what they call real work, boy. I'll tell you what.
Sure.
But no, I mean, I don't know.
That didn't affect your back lifting like that?
Well, I knew how to lift right.
Okay.
You know, I kind of compensated for it, and then, you know, as you go along, those muscles that are involved in doing that get stronger, so they support you better and so on.
Okay.
So I managed, you know, I mean, it was, man, I couldn't believe how much weight I would actually lift off the ground.
No kidding. Were you just a
Every day.
teenager?
Early 20s.
Early 20s.
Early 20s.
Wow.
Yeah, we handled feed, fertilizer, cement, and salt.
Whoa. All heavy products.
All heavy products, you know, and if you, I used to mix horse feed, you know, we mixed our own feed. It was a cool job. I mean, because I got to deliver it all over the county, in Kent County in Michigan, and so on. But
That doesn't sound fun to me, but all right.
I mean, you know, I would put all the ingredients in the big mixer, and then it comes out into a burlap bag, and when you settle, you know, you put 100 pounds in a bag, okay? So when you settle that feed before you tie the bag off, you're picking it up by the ears and bouncing it on the ground.
Whoa.
Okay, that's 100 pounds, 100 pounds, 100 pounds, boom, boom, you're actually lifting up.
Okay.
Okay, and the amount of, I figured it out one day, I can't remember how much it was, but it was many, many, many tons every day.
No kidding.
Oh, yeah. Yeah, so
That'll put you in shape.
I got a lot of respect for guys who do that. But I was careful.
Uh-huh.
I was careful about, I mean, when I went to pick up 100 pounds off the floor, I never bent over to pick it
Now,
up.
how would you know that as a young guy? Young people don't usually think about that. They think they can jump over the moon.
Yeah, well, you can, but somebody, I don't know, I met somebody who said, be careful.
Okay.
They said, you know, I mean, you don't think anything can happen to you, but if you do it this way, you're not going to be as tired, it's going to be easier for you. And I said, that sounds good.
Absolutely. So you listen.
So I listened. Yeah. I was going to ask you what your view is on inversion tables.
I love them. I've been wanting to get one. I just unfortunately live in a house that's been taken over by a 15-month-old.
Oh,
So
Oh, boy.
I don't have room for it.
What is an aversion table? I have no idea.
So, well, it's good as long as you don't have problems with blood pressure,
Mm-hmm.
because you're literally going to be inverted.
You lie on this table and there's these things that grab onto your ankles that are cushioned.
Okay.
You know, so it's comfy. Okay, and here's your head, and here's your feet, and you put these things on, these clamps on, that are comfortable.
Okay.
And then the table does this by gravity.
I think I've seen them in movies and stuff.
So you're hanging by your ankles, and what that means is that all the things we've been talking about in terms of compressing the spine is reversed.
Yeah.
So it's opening the spine up.
Okay.
And I guess the big thing I would say is that if anybody were to watch this and say, I think I might want to go buy an inversion table, you never want to go from being on your feet to completely inverted. Just because it's such a blood rush, it may be way too much
That's right.
for your body to
Right.
tolerate at first. You want to basically build yourself up to being able to be completely inverted.
So you go
Yeah.
Oh, okay.
for a
Little bit.
while, for a few sessions, right? And
Yeah.
then
Yep.
And then-
Each time you.
So a regular private person can buy these things?
oh yeah.
Hmm?
I guess I'm a little vague on that, but I have seen them in movies or something,
Well, the way doctor's saying is the right way. I mean, you don't want to just, and if you do have blood pressure problems, you want to talk to your primary care doc about that before you
Mhm.
do it. But most people can tolerate it okay. And if you do it properly, like doctor says, and you build up,
Yeah.
and you get to the point where you can go full inversion, I mean, you get some benefit even if it's only partial.
Sure.
But if you go full inversion and you build up your tolerance so that you can stay there for a while, how long is a while? 5 minutes?
5 minutes is usually. I mean, I've heard the extremes of somebody saying they could hang there and watch a half-hour show.
That's really
But to
intense.
me, I'm like, yeah, there's no way.
That's not the goal.
No, you're not trying to watch a show while hanging, but
Or pretend you're a bat.
Pretend you're that. But
5 minutes is a good time, and you usually do need if you can, once you can get fully inverted, and you can do that for 5 minutes. I would say you come back up, you rest for a minute, 2 minutes, let things kind of settle back down, do it again. You know, do that a few times,
Right.
a couple repetitions of that. But those things, you know, you could do them multiple times during the day. So,
Now, I'm just gonna tell you, I have one.
Oh, really?
Oh, yeah, I have one,
And you use it?
and I use it
that may be over.
anytime. You know, it's hard to get through this life without having some low back issues.
True.
Okay, it's tough. I mean, you talk to anybody out there, a lot of people, again, people are gonna be relating to this, I know.
Mhm.
Yeah, my back hurts. Well, so does mine. Well, and most people, the way we're built, the way we live our lives, all the things we do, the way we get in and out of cars, the way we pick things up, you know, we're gonna have low back issues. Very, very common problem. And boy, I'll tell you what, that inversion table, you can tell that it's helping.
Mhm.
Wouldn't you say?
Oh, it definitely would help.
Do you do the 5-minute thing?
Oh, I go 3 to 5.
Yeah?
Oh, yeah.
Is this something you just started, or have you been doing it?
I've been doing it for a few months.
Really?
Yeah.
Okay, and you feel better?
Oh, yeah.
Okay.
Oh, you can definitely tell the effect. I mean, you know, when things are compressed, the body doesn't like it. It squeezes the blood vessels, it interferes with the blood supply.
Right.
Okay, and when you take that gravity pressure off, it lets the discs rehydrate a little bit, and it carries over. I mean, you got to keep doing it, or you lose the effect.
Okay.
But if you have, for certain kinds of low back pain, I would imagine, certainly in my case, there's a beneficial effect. I mean, you can just tell.
Mm-hmm.
Your back feels better.
Mhm.
Period.
Yeah.
And I don't think it'll make your pants fit any better, but
You're not going to gain your height. You're not
You're
going
not-
to gain the inches you lost.
No.
that's
No.
what I meant.
Okay.
Yeah, that's
I'll
permanent.
I'll let
so.
that go then.
Yeah.
Now, you and I have talked about, now you haven't given this to me, and I probably don't need it yet, but spinal decompression. And you can do that.
I can, and I did a form of it.
You did a form of it that
Yeah.
day.
So there's the spinal decompression is mechanical. There's a weight, a pulley, the computer controls all of that. I did a more manual approach.
Okay.
It's called flexion and distraction, but it's the same. That was what was around first.
And I could feel when Jerry, and he has a table that kind of goes down, and I don't know what part of that procedure caused it, but I could feel different things where it was pulling. And at one point I said, Jerry, I'm getting a pain in my right leg, and you did something with the legs. You just pulled them back or something.
Yeah, so when I'm doing it manually, I'm obviously looking for feedback from you.
Mhm.
In that case, when you said, yeah, I'm starting to feel it, so we know we're stretching too far. I'm pushing the table too far down, putting too much
Okay.
stress on those muscles and on the spine. So I backed off a little bit, and then that.
And it went away?
Yeah, it went away.
And you also told me that you will feel, if you have this procedure done, you will feel, in some cases, the next day you'll be a little sore. The only thing, I was a little sore in that area that I've been having problems with, but the rest, I felt great the rest of the way.
And it's not just with that therapy. I would say if you've never been adjusted, or if it's been a number of years before your adjustment, since your last adjustment,
Mhm.
there is always a good chance that there is some soreness. That's normal. That's your body
Oh, yeah.
responding to what I did. Usually ice and plenty of water takes care of that soreness.
Okay.
If it becomes intolerable,
Ice instead of heat?
in that case.
Okay.
Yeah, nobody's a textbook, so yes, when you have tender spots or soreness, usually ice works. 20 minutes on, 40 off. There are some people that they put ice on and that pain gets worse. Well, then in that case, heat would be what works for them.
The alternative. Okay.
Yeah. So.
One last question from me, stenosis. Can you explain that?
Very good question. very important topic.
Again, it's just on that whole line of degeneration. Well, I mean, it can occur any level of your spine. Usually we see it in the low back, and again, it's when the bones are starting to come together. Each vertebrae, there's so many in each part of your lumbar, thoracic, cervical spine. When things aren't moving, your body tries to take over and connect to things that are moving. And stenosis is when you start getting, those bones coming together. And once that happens, they're...
Didn't you tell me that the decompression stuff would not work on stenosis?
Right. I mean, it's not going to fix...
It's not going to fix it.
It's not going to fix it. Once you have it, it's there.
Okay.
Unless you have it surgically removed.
Which my mother did. Yeah.
But then again, that's not...
Yeah.
There's not a guarantee that it's going to fix that.
Right, it's a tough problem. Stenosis, just as a generic term, it means narrowing. Okay, and there's a couple of different places in the areas we're talking about. One thing that can narrow is if you could pull out your spine there.
Absolutely.
Here you can see a nerve coming out from between the vertebrae, and these nerves come out and they wrap around the body, and they innervate the muscles, and the sensory nerves come out, and so on and so forth. And there's a little opening, there's a little canal there.
Hold it that way towards there.
There's a little canal where the nerve comes out. Now, if that canal narrows, it starts to put pressure on the nerve, which can be very painful.
Oh, I see.
Okay,
No.
so that foramen there, that foraminal stenosis is a problem. And then you can't see it here, but we can see it. We can see the spinal cord running up through the vertebrae. And if the opening in the center of the vertebral column where the spinal cord goes, if that starts to tighten down, that's called spinal stenosis, which can be a terrible, terrible problem.
Do you see a lot of that with?
Not me. Well, I mean, that's not something I take care of.
Right.
That's outside my...
You would send them to a spine specialist?
Well, yeah. I mean, somebody with that kind of pain may well see Jerry first.
Oh.
Okay, because they're going to have real back pain. Okay.
Right.
And through his evaluation, his assessment, and the different things he does, he's going to be able to tell whether this is something that suggests a stenosis kind of a problem or not.
Okay.
And during I'm just going to assume during the course of his evaluation of that and working with the patient, he may obtain some studies to prove or disprove that, such as a spinal MRI, for example.
Mm-hmm.
Okay, which gold standard. I mean, that will tell you.
Yeah.
Okay.
Mm-hmm.
So he'll pick it up. Sometimes when I hear people talking or just watch them, I can see and I ask them about it. And the kind of pain that comes from spinal stenosis is just savage pain. I mean, it's very debilitating pain.
Mm-hmm.
And the only thing you can do in a case like that is surgically to decompress that, and which is frequently very successful in terms of pain relief. It's not without the potential for complications. It's not without the potential for recurrence. But somebody who is in that kind of pain, if they can get some pain relief, it's worth anything.
It happened to my mother a couple of years ago. I think you and I talked about it, and she had to go through UH in Menor, Cleveland, specialist that you suggested, a surgeon.
That probably would have been Chris Fury, I would
Yes,
think.
yes. And within 2 days after that surgery, which turned into a 3-hour surgery, it was only supposed to be 45 minutes, but he went in and really did some major stuff. And believe it or not, she could walk in 2 days perfectly,
I believe it.
without pain.
I believe that. That's obviously that's the outcome we always want. But what he did was he took that bony crushing of the spinal cord away,
Mm-hmm.
so the pain stopped.
Yeah, yeah,
Yeah,
very successful.
yeah. But that's, I mean, the number of people walking around with back pain, okay, that's going to be a small percentage of those
Right.
people. Most of the people are going to have conditions which Dr. Orlando is going to be able to help them with.
Okay. What are your hours, Jerry, and days and stuff?
So I'm in Conneaut all day on Monday, usually 8 till 5. Wednesday I'm here in the mornings, 8 till noon, and then Friday, again, I'm back here all day, 8 to 5. And then the other days, you could, if you really needed to see me, I have another office up in Ashtabula at State Road Medical.
Right, okay. Okay, very good.
Now, Matthew, did you get Jerry's telephone number?
Yeah.
Okay, so people have already been seeing that number floating across the screen, so they'll see your number so that they can write it down. Okay?
Yeah, we want to wish you luck.
Well, thank you.
Yeah, glad you came back home. That's a very important thing in this town. We want the kids to come back home and
Yeah,
work
especially guys who can bring some expertise that benefits all of us.
here. Absolutely, absolutely.
Yeah, that's
I'm
terrific.
glad to be here, so.
Yeah, that's
Yeah.
great.
Well, I'll tell you, anybody who looks at you and doesn't see the resemblance to your dad, holy smokes. I mean, I could tell just like
I
that.
know, I hear it all the time.
I'm sure you must, I'm sure you must. Yeah.
That's great. All right, Jerry, we want to wish you luck.
Thank you.
All right.
All right.
Now, remember, your health matters. We want to hear from you. And Dr. Bryant, they got a number right there.
Yeah, or you can email Pat. Again, we always say this, but we welcome your questions. We really welcome your questions. You can send them to Pat. He gets them to me. You can call my office. And, you know, we did several shows last year, Pat, where we addressed questions.
And we're probably getting due, because I'm starting to get some more, so we're probably getting due where we probably will have to do one of them when
Oh,
we have
that'll
an
be
open
fine.
date.
That'll be fine. Yeah, just get them over to me so I can make
I
sure
will
that I
do
get the
that.
information that's really going to be helpful.
Okay, I'm going to do that.
All right.
All right, folks, have a great week. We'll see you next week.